We have a conservative plan over here. The House bill is basically straight up expansion.
And the sky won't fall if we work together and adopt something that will help the poor and the needed and the rejected.
Senators may call it Medicaid light, but the governor still calls this Medicaid expansion plan bad policy. We'll have the very latest on one of the 2024 session's key debates. Also, why are Hinds County supervisors feeling the heat over proposed changes to voting precincts? We'll take a look this Sunday on Mississippi Insight. I'm Byron Brown. Thanks for joining us for this Easter edition of Insight. Last week, we saw new momentum in the state Senate toward some measure to expand Medicaid coverage to Mississippi's working poor. But Senator's plan looks a lot different than the House bill passed in February. The Senate's Medicaid Committee advanced House Bill 1725 after essentially rewriting it. Senators want to cover those workers earning up to 99% of the federal poverty level, or about 80,000 people. That's far less than the 200,000 plus than the House plan might cover. The Senate's version also includes a work requirement mandate. The full Senate took up this bill Thursday, even as Governor Tate Reeves warned that the legislation is bad policy. 12 News' Richard Lake has details on what happened to the bill on the Senate floor.
Byron, Senate Medicaid Chairman Kevin Blackwell insisted early on in the debate that anything coming out of his committee would be a highly conservative measure. He made good on that promise Wednesday. The Medicaid Committee essentially took the House's own bill, issued a strike-all amendment, and rewrote the bill to its liking. And it is a substantially different measure. It covers tens of thousands fewer working Mississippians than the House measure, and critics say it will leave millions in federal dollars on the table. Still, the legislation passed the Senate with a veto-proof majority of 36 in favor, 16 against. The House's plan also passed with enough votes to overturn an anticipated veto from Governor Tate Reeves. Here's some of that debate.
I know on this particular topic, people have their opinions, and that's certainly fine. The problem is when they espouse those opinions as facts. While these people are certainly entitled to their opinions, they're not entitled to their own facts. Many of the comments we've seen recently on social media are misleading, inaccurate, and designed to be inflammatory. So let me give you a few of my facts, and you can come up with your own opinion. I've been on record as opposing Obamacare Medicaid expansion, and I'm still am. So when the Lieutenant Governor asked me to work on health care reform, I had a little heartache. I told him I could not support Obamacare expansion and Obamacare expansion bill, nor many of my Republican colleagues. He then engaged me to come up with a plan I could support. After many hours of meetings with the Hospital Association, the Department of Health, Medicaid, the Department of Insurance, and representatives from our managed health plans, we have a bill in front of us that I think I know I can vote for. This bill is not Obamacare expansion. This bill is a very responsible and conservative bill geared toward helping the working poor. Obamacare is removing individuals off the health care exchange who are making between 100 and 138% of the FPL and putting them on the Medicaid rolls. Currently, the federal government subsidizes premiums, deductibles, and co-pays for these individuals based upon their income. They all have to be working in order to be on the exchange. One of the arguments for expanding to Obamacare Medicaid is that we need to help increase our provider pool. By expanding to Obamacare, we could actually be limiting our provider pool. The exchange, which is commercial insurance, compensates providers about 40% higher than Medicaid. The health care benefits as well as provider access are much better for the exchange participants than those in Medicaid. It makes no sense to remove approximately 140 to 150,000 people off the exchange and onto Medicaid with the subsidies currently offered by the federal government. What this bill does do is it helps the working poor who earn between 0 and 100% of the FPL. These are the poorest of the poor who are working or going to school and need a hand up. And that's exactly what this bill does. It's giving a hand up to those who are trying to be successful. And it's not in the form of in cash, big screen TVs, but in the form of an opportunity to see a doctor and not go bankrupt if you get sick. This plan has the potential to be transformative for these individuals. As their incomes increase, it will allow this population to move to the exchange where they can remain there until their income exceeds 400% of the FPL. I've heard over and over legislators saying they don't mind giving people a hand up versus a handout. This bill is a hand up. This bill restores dignity and provides hope for the future of these individuals.
We go by the rules of CMS. No matter what we put in a bill, CMS controls the rules and regulations for Medicaid. So when you go back home and you talk to your folks about Medicaid expansion, just know that you're not only adding Mississippians to the Medicaid rules, you're adding any immigrant that comes into the state of Mississippi that's in any of these categories as asylees or refugees paroled into the U.S. for a year. They would qualify as well to get Medicaid under this expansion.
The thing I can tell you is the Affordable Care Act has been studied to death over the last 12 years. And it has been studied by our state economist. It's been documented, of course, that Mississippi has refused $1 billion a year, every year for the past 12 years. That's $1 million before lunch today, $1 million this afternoon, and $1 million after we go home for supper tonight. One key point that I want to make that is different about the strike-all amendment and the House bill. The federal government has said to states that expand Medicaid, and that is to 138% of poverty level, which the strike-all amendment does not do. The federal government will provide for 2 years a total of approximately $624 million to the state's general fund by enhancing the FMAP by 5%. That's more than $600 million. Because of that increase, the state economist has projected that if we were to take the House bill by going to 138% coverage, we would increase the annual GDP of the state by $750 million a year. We would increase the number of jobs in Mississippi by approximately 11,000 jobs every single year. We would increase the income that Mississippi earns every year by approximately $800 million. We would also grow the population of the state. We would also be able to transfer large categories of people who are currently getting the Medicaid match to getting the expansion match. That would save the state of Mississippi approximately $50 million a year. These are people who are disabled. These are people who are pregnant women in certain categories, people who have breast and cervical cancer, and people who have corrections, as Senator Barnett said. The ability to transfer those folks from the lower match rate to the enhanced match rate would save the state $50 million. The House bill would do that. The Senate bill would not.
I don't like this bill, but I plan to vote for it because it's better than what we have right now. There's a lot of rhetoric out there about Medicaid, Medicaid expansion, Affordable Care Act, Obamacare. But I want you, as elected senators for the state, to listen to what your constituents are saying instead of the rhetoric. You'll hear from small businesses who say that they're having a hard time affording health care for their employees. You'll hear from rural county supervisors and local government officials that say that their rural hospitals are about to close. You'll hear from local law enforcement, and those officers will say that they're spending a lot of their time dealing with people who are mentally ill or who have substance use issues. And if you listen to doctors and healthcare administrators and providers, they'll tell you they have a tough time treating indigent patients. And if you talk to people who are working hard, making a living, and who can't afford health insurance, they'll tell you this is a good deal for Mississippi. The expansion of Medicaid is a good deal for Mississippi. It saves people money. That's conservative. It saves businesses money. That's conservative. It saves lives. That's conservative. And in the bipartisan spirit that I'm witnessing here today, I think we should approve this bill and continue to improve it as we go forward.
We had a vote today on helping working people in Mississippi. We campaigned on that this last time. I was pleased to see the Senate step up into this discussion. Appreciate the House bringing it up. We had an opportunity today to find that moms who may have 2 kids and working 2 jobs, making $25,000 a year, and they get sick and they don't have any coverage. And what they're talking about is whether or not they have enough fuel to get to work, how they're going to feed their family, how they're going to pay for a house or a place to rent. Healthcare wasn't even one of the top 3. And if we as a society, we as a state, believe that we should have individuals who are working, stay in the workforce, pick up our labor force participation rate, we needed to do what Senator Blackwell and the Senate did today. This is a conservative amendment. If you will note during discussion, they discussed the fact that this was appealed during the Trump administration. And we're going to carry the vote here for President Trump. So you also heard, oh, what happens if they deny it here? If we have a new president, we're going to have this bill passed. So all of these reasons, and I respect the senators that had their discussions, you heard them all. But I also respect the fact that the Senate debated this full and completely in our committees and again on the floor of the Senate today. And what you saw was Mississippi take a step forward to helping each other during what is a very holy week for most of us.
Again, Senate leaders have characterized their plan as the more conservative, fiscally responsible expansion plan. It would cover those aged 19 to 64, making up to 100% of the federal poverty level. That's a little over $15,000 a year for one person. It's estimated to cover roughly 80,000 Mississippians and has a work requirement of 30 hours a week tacked onto it. The Senate plan will live and die with this work requirement. If the federal government does not approve it, nothing in the plan will go into effect. The House plan would cover the same age range, but includes those making up to 138% of the federal poverty level. That's nearly $21,000 a year for one person. The House plan would cover an estimated 200,000 Mississippians and has a work requirement of just 20 hours a week included. Unlike the Senate plan, the House plan has a backup written into it. Section 2 of the House plan mandates that if the federal government does not approve the work requirement, traditional expansion would kick in. Now the stage is set for House-Senate conference negotiations. Both chambers are aware that any agreement will likely face a veto by the governor. We'll wait and see whether a final deal on Medicaid expansion can withstand such action. For Mississippi Insight, Richard Lake, 12 News.
We'll hear more on the debate over Medicaid expansion when Mississippi Insight continues. One of the key advocacy groups of the Medicaid expansion debate is the Mississippi Hospital Association. The group's interim president spoke with reporters last week as senators worked on their version of the legislation.
Well, we are obviously, we appreciate the effort of the Senate to do something. We want this legislation to move forward. We want it to move, and so right now we really just want something to go through, so hopefully this can get to conference and the two sides can talk about this.
Are you hoping for more to come out in a conference committee?
Yes. Yes, we are.
The comments about the exchange and pulling people off and the impacts that it could potentially have on hospitals, do you follow along with that? Do you agree with the comments from the chairman?
Well, right now Medicaid is one of the better payers in the state. And so the exchange, there are some who have high deductibles on the exchange, and there are some who simply cannot meet those deductibles. And when those deductibles can't be met, it leaves hospitals with Obviously, that's a write-off. They're not going to be able to pay that, and so they're left with bad debt.
It's long been acknowledged that a thorny issue like Medicaid expansion can only be worked out through cross-chamber negotiations. One lawmaker who could be key to those conference talks is Representative and House Minority Leader Robert Johnson.
I just think after 14 years of saying no, that we pass a plan that says no. I mean, that's essentially what we're doing. If you're only covering people, you won't even cover people up to the 100% poverty level. And so none of that makes any sense. If we really are trying to make sure we save hospitals, or we're trying to cover working people, then we need, the federal government says, at least up into 138% of poverty, which is a single person making $25,000 a year. We ought to be willing to do that. These are working people. These are people who are being productive. These are people who are paying into the state economy. These are people who are recirculating dollars. You want them to be healthy and continue to do that. And that's all we're trying to do. The Senate plan retards that effort. It essentially kills any effort to really expand Medicaid.
Talk to me about the federal match situation right now. Under the Senate plan, Mississippi wouldn't be receiving the 96%, is that correct?
No, that's right. Under the Senate plan, it would cost Mississippi an extra $26 million a year. Under the House plan, we'd get $600 million. That we could use to we could use that money as the match, the federal match for it. So at least for the first 4 years, we'd have 100% coverage on Medicaid expansion, 100% coverage across the board. That's what we would do. Under the Senate plan, it doesn't do any of that. And so all the things that make this plan work, after waiting 14 years to implement a plan, all the things that make it work, the Senate killed everything that would make it work. And the House plan, even though as a Democrat, I don't think it goes as far as it needs to go. I think we ought to be covering more people, even if it means that they have a copay and we subsidize the payment. We should do that. But at least the House plan covers the 200,000 people we've been talking about for years. The House plan does that. The Senate doesn't.
Can you talk to us about the work requirement?
I keep telling people. A lady made a great point earlier. Well, one of the requirements under the Senate plan that they're going to cover people that make $15,000 a year. Well, you can't make $15,000 a year if you're not working. So, I mean, the people we're going to cover on a Medicaid expansion are working. If you don't work, if you are an able-bodied adult, male or female, under the age of 65, and if you're female and you're not pregnant, you can't get Medicaid coverage. I don't care whether you put a work requirement or not. You just don't qualify. The only people that will qualify are people under expansion are people who are working. That's already a requirement. The problem with putting a work requirement is there are people like students and people who would otherwise be working, but they're trying to finish college. We want them to be healthy too. That's a small population of people. And so having them require them to work a certain amount of hours when some students are probably working, but no more than 15, what they can do and study at the same time. We don't want to leave them out. They should be covered, and we want to do all we can to make sure we have them as healthy, productive people finishing college and going to work.
Follow 12 News throughout the week for updates on Medicaid expansion and other legislation moving through the state capitol. We're back in a moment. The Hinds County Board of Supervisors is getting pushback amid moves to merge several precincts across the county. Supervisors voted on February 5th to approve several precinct mergers across Hinds County. Precincts 54 through 57, 60 and 61, and 73 and 74 would all be impacted. State Representative Zakiya Summers represents many of those precincts, and she says she's worried about the impact this could have on her constituents. This decision by the board could also impact Summers' standing as a state representative through House Bill 1655. That bill has passed the House and has been referred to the Senate Elections Committee.
Time that people have to take to figure out how they're going to get transportation to a precinct, time that they may have to stand in line because there's going to be an increased number of voters at their precinct, and then time that they're taking away from either their family or from their job and lost wages. The move to merge and close these precincts amounts to voter suppression. It says that if you cannot show a record of voting in your district for 2 years, then you can be disqualified from the ballot. If this move continues and my precinct is moved to Black's Chapel, then I would be effectively voting in another representative's district, which means I would not have a record of 2 years worth of voting in my own district. I really think the board needs to go back to the table.
The board's February vote was held on a motion Tuesday morning by District 4 Supervisor Wanda Evers. Supervisor Evers originally voted to merge the precincts, but now says she has changed her mind after seeing the possible impacts. A vote to rescind the precinct changes will be held at the next Board of Supervisors meeting tomorrow. If you have comments or questions about today's show or a suggestion for an interview or a segment, just drop us a line. Email our producers. The address is news@WJTV.com. Big thanks to senior political correspondent Richard Lake for his hard work at the Capitol. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown from all of us here at 12 News. Make it a great weekend.